Listen to how this psychiatrist talked about me when I was in crisis. There's a chance Jessica will attempt in the future, particularly if there's a stressor. Hospitalizing this patient can be harmful as it promotes dependence on acute care. Jessica will simply learn to run to the hospital whenever there's a difficult situation. Because apparently I have no previous history of being able to handle difficult situations on my own, right? I think the best way to keep Jessica alive is to encourage practicing distress tolerance. Jessie, I know you're saying you're gonna, but I'm gonna need you to just deal with your problems and tolerate them, okay? Thanks. This file says no recent diarrhea. I've had diarrhea for 7 years. That's the first thing I ever say to a doctor. What? Despite the high sedation, she did have challenges with the upper endoscopy, though the exam was complete. Why is that? How was it completed, even though I was having a hard time with it and wanted it to stop? You just pin people down. I suspect part of her symptoms are functional in nature, meaning there's no way to show what's wrong with them. You've done one test. You don't want to run any other tests before you determine that there's no way to figure out what's wrong with me? We're just gonna jump to conclusions here without gathering evidence. Small internal hemorrhoids. I've had diarrhea for 7 years. Why would I have hemorrhoids? That's typically like a constipation thing. You don't wanna look into that, or... I didn't even know the gynecologist said I had vestibulodynia, a chronic pain syndrome on the vaginal opening, commonly seen in patients with endometriosis. So why did you not suggest testing for that? Or say that to me? Or no one said that to me? We just... Okay. She referred me to this other doctor for that, who just said that I recommend she follow up with her gastroenterologist. Pelvic pain may be assessed at the pelvic pain clinic at BC Hospital, which I thought he referred me to. But it says I'll leave these referrals to your discretion, which was my NP. You need a letter from a gynecologist to get referred there. He also said I suspect painful bladder syndrome and just hands me off to someone else. Like, I waited months for you, dude.